Welcome back to the Best of Health. Now, from time to time, we have topics on the Best of Health that require sensitivity. Perhaps some of you even feel uncomfortable talking about some of these discussions related to health, and this may be one of those times. But as you'll learn from our next guest, education is the key to better health. Now, we're fortunate to have with us Dr. Ralph Zipper. Dr. Zipper is one of the nation's most recognized leaders and postdoctoral instructors in urogynecology. He developed an incisionless procedure to help women who experience vaginal relaxation syndrome and has personally trained over 1,000 surgeons in his techniques. He's the inventor of some of the newest and most promising techniques and devices for the treatment of urinary incontinence and pelvic organ prolapse, including a sling method with a 99% success rate. Dr. Zipper, welcome to Best of Health.
Victoria, thank you for having me.
All right, let's get right into it. Tell us, what is vaginal relaxation syndrome?
Victoria, what is really interesting and important to take note of is that there are more women on this planet that have had babies than women who have not had babies. And we know that the majority of these women suffer from something called vaginal relaxation syndrome. So what is vaginal relaxation syndrome? It's a syndrome defined by a group of symptoms that essentially say things are different. I had a baby and things just aren't the same. When I'm intimate with my husband, with my significant other, things are not the same as they were before I had a baby. And when patients come in to see me to discuss the GIVE procedure, the GyneShape Incisionless Vaginoplasty, which treats that syndrome, they often say, Dr. Zipper, I had a baby, things are just not the same. The vagina, it feels looser. I don't feel the penis as much. I don't feel friction. I feel like the penis may fall out. And the more and more I do of this, I keep on hearing something that's very disturbing. Many women will say to me, Dr. Zipper, when I'm making love to my husband, since I had the baby, I actually try not to get too excited because the vagina just feels so big and loose already. I don't want it to get even bigger when we're in the process of making love. And to me, that is sad and very concerning, especially now that we have a treatment for it. And it's important that women are educated to understand that there's a great incisionless technique that can treat this syndrome.
And that they're not alone, and that this is a common thing that happens. Tell us about the treatment for this.
Well, if you would have asked me that question 10 or 12 years ago, my answer would have been, there is no treatment. Over the last decade, there are surgeons that began offering treatment that they called laser vaginal rejuvenation. Not so sure if that's fair, because really the only thing that was done and is being done by most of these surgeons is a laser is used to make an incision, but then it's old-fashioned surgery sewing things up. And we know that once suture comes out to sew inside the vagina, there's a 20 to 40% failure rate of the surgery, a distortion of anatomy, and a high rate of discomfort, which is unacceptable when your goal is to improve that intimate area of a woman's life. For many, many years, I trained surgeons. You had mentioned over 1,000 surgeons in techniques in pelvic reconstructive surgery as a urogynecologist. And I was very bothered by the fact that originally there was no treatment for these women. And then when there was a supposed treatment, it was, from my standpoint and most practicing pelvic surgeons, not a good treatment. So I spent hundreds of hours over many years developing an incisionless laser technology that can decrease the size of the vagina by 20 to 30% without an incision. And the way this works is it works directly on the natural collagen surrounding the vagina, the supporting tissue which has become stretched. It creates shrinkage, but also causes new cells to migrate in and lay healthy new collagen around the smaller vagina.
Okay, so this sounds like it's the most cutting-edge thing that's come on the market of this, especially for women that didn't know that there was treatment for it, or hope in this case. Now, they may be asking themselves, all right, is it painful? How is the recovery time? Can you answer those questions for us?
Absolutely. When we perform the GyneShape Incisionless Vaginoplasty, which we call the GIVE procedure, the most common thing I hear from patients, Dr. Zipper, are you sure you did anything? Because I'm really not that uncomfortable. And it's amazing to me, for as non-invasive as this procedure is, how much women benefit and how happy women are.
Now let's talk about, because maybe some women feel like, well, maybe my symptoms aren't that bad. Give us the spectrum of the symptoms from, we talked about, you said incontinence, all the way up to prolapse. Explain to us what is prolapse?
Well, The vagina is normally the size of a small lemon, and when a woman has a baby vaginally, they're pushing a small watermelon through that area, and it exceeds the limitations of the tissue. Perhaps the greatest lie a woman is ever told by a doctor is that things will go back to normal after you have a baby. Things will improve, but they won't go back to normal. The smallest degree of injury results in vaginal relaxation syndrome. Things aren't coming out, the bladder's not hanging out of the vagina, the rectum's not bulging out, but there's been an enlargement and a loss of sensation, a loss of friction with intercourse, a looseness. As things get worse, organs can fall out, and that is not vaginal rejuvenation, it's not an incisionless procedure, it's urogynecology, it's pelvic reconstructive surgery. The symptoms of women with vaginal relaxation syndrome are those of an adverse effect on their intimate life. The vagina feels looser, I don't feel friction of the penis, I feel like the penis is going to fall out. This is the basic spectrum. It could be slight or it could be severe.
Okay, so not only did you come up with this procedure, but you developed the laser as well.
Victoria, it was a very arduous process. It was over the course of years. Not only did I have to develop the method, I needed to develop the laser technology. A great deal of software and firmware went into this laser. It's a very unique laser, and the settings are from thousands of data points that we found were necessary not only to make the vagina smaller, but to create the normal, natural shape and contour of the vagina from before pregnancy.
Okay. Now, if somebody wants to get more information, if women want to and probably need to get more educated on this subject before they go and talk to a doctor about this, where could they go to find this out?
Thank you so much for asking. It's so important because there's so much bad information out there. There's a website we created called thetruthforwomen.com. T-H-E, you have to put the in there, thetruthforwomen.com. And there they will learn about their anatomy, what's normal, what's not normal, and what the real treatments are for these disorders, especially the incisionless vaginoplasty surgery. There's also
you have another one, right?
Right. There's also another great website called abagyne.com, A-B-A-G-Y-N.com, which not only educates and explains these disorders, but shows patients where they can go to find surgeons. Because remember, you have to be careful about surgeons that say they do a laser procedure, but really they're just using a laser to make an incision, and then they're using suture material.
Okay, and if somebody wants to contact you directly, how would they do that?
Both of those websites have contact information, not just for me, but for other surgeons who do these procedures, phone numbers, and even links where they can fill out forms and get more information.
Wonderful. Thank you, Dr. Zipper, for being with us on Best of Health TV.
Thank you so much for having me.
And I hope you found this segment informative. We're so glad to see that another area of women's health is getting the attention that it deserves. If you have a health topic that you'd like to know more about or have a comment on the show, contact us at www.bestofhealthtv.com. Thanks for joining us. I'm Victoria Lambert, and I will see you next month on Best of Health.
For more information on health issues, pick up a copy of National Health Review magazine. National Health Review is Central Florida's premier source for dedicated health, wellness, and medical information. An award-winning publication, National Health Review magazine is published locally and focuses on what you can do right now to improve your well-being with easy-to-read and entertaining stories, resources, and local services to help you live longer and healthier. To learn how to pick up your free copy of National Health Review or to sign up online for health briefs, go to www.nationalhealthreview.net.